Everybody, Pelagie Ndamnsa here and Ottawa. So I've heard to come to YouTube and I hope I'm welcome. So I got a job to work as a set nurse for a movie production, and I've been posting short videos of how everything's going on set, about myself working as the set nurse and all other stuff, right? And I've been having questions coming, oh, like, what is that? What are you doing? Are you acting? How did you get this job? And all of that. So I was like, I've been answering them in my inbox in the comment section, and it's just stressing. I'm like, okay, it's just I make a video that's going to help people. Like, if somebody asks me a question, I'm like, watch this video, you have all your answers on this video. So this is the video we are making. Yeah, let's go right into what we are going to be talking about: set nursing. Everything you need to know about set nursing is going to be in this video. If you're new here, I am Pelagie Ndamsa. I am a nurse. Wasn't practicing for 3 years, and I'm based in Douala, Cameroon. Welcome to my world. One, what is set nursing? That's the question I've been receiving all the time, because it's not like people ask me, but it's when they respond and they're like, "Oh, so you're acting?" And I'm like, "No, I'm not acting. I am a set nurse." They're like, "So what do you do as a set nurse? Is it that you're acting in the movie as a nurse, or what is it all about?" So what is set nursing? Let's answer that question. A set nurse is a trained nurse who has been employed to take care of the cast and crew of a movie production. It's generally not all about a movie. It could be maybe a movie video, a publicity that they are shooting, and they need someone to be there. Some shoots take days, to take weeks, to take months, so they need a healthcare personnel to take care of them in case somebody is sick or there is an emergency on set. So that's it, simple as that. You could be a trained nurse, you could be a medical doctor, anybody who has skills in the medical field. Second question I received is, how is set nursing different from bedside nursing? It's obvious. Set nursing, you are out there in different shooting locations and you're just following them everywhere they go. It's been your area, like I'm in Douala now, I'm shooting in Douala. It could be in Yaoundé, it could be out of town, it could be in Rwanda, it could be in America. Anywhere they can book your flight to, you are going to play your role as a set nurse. Why bedside nursing ends in the hospital? It maybe you're working in one hospital, every morning you clock in, clock out, clock in, clock out, and you're working. So that's basically what it is. Let's dive straight into the third question. The next question I've been receiving is it a permanent job or freelancing? It could go both ways, but what I'm doing, I'm freelancing because I'm working per project. If there's a project, if Juanita S has a project right now, I work with her. If Lillian Production has a project, I work with them. If Stephanie Tone Production, MB Productions actually has a project, I'll work with them. If Scan Quintus has a project, I'll work with him. So I'm freelancing. I'm not leaving my bedside job for now. I'm still doing my bedside nursing job, and that's because I'm not getting somebody that's going to be like, okay, I'm hiring you full time to work with me as a bedside nurse. By the time as a set nurse, by the time I get that, I'm doing my bedside nursing job because it's more stressful than this. This one you get to flex, relax. You're not doing nursing all the time. They could be shooting all day and then you're not even there because it might not need your services. By the time they need your services, you come in and then you do what you have to do and then you leave. So if anybody wants me as your full-time set nurse, I'm open. Wherever you're traveling to, you carry me and you pay my tickets and you're good to go. The next question I've been receiving is, what are the qualifications you need to be a set nurse? Obviously, you need to be trained with a well-recognized school, be it in Cameroon or in the world. And then you need to understand basic life support. You need to understand how to do CPR, cardiopulmonary resuscitation, because there are cases where somebody will need that, and then if you're not trained, if you're not equipped for those things, for those emergencies, you're going to be panicking, and it's not going to help the profession. It's not going to help your patients. It's not going to help your clients. It's not going to help your career in any way. And you need experience because you cannot just leave from school and then you want to start doing said nursing. It's going to be very difficult for you to, because there are a lot of things that you gather from bedside that you're going to need on set. The next question is, how did I get into the film industry? For those who know me, they know I'm a connectologist. Yeah, I know how to connect. But it's also like man no man kind of thing, right? So I've known Miss Brenida SK for like 3 years now, and we've been meeting in various youth groups, and I didn't know she was a producer at the time we met. So when I was seeing her stages, I'm like, no, this is a producer. And then towards the end of last year, 2024, I saw the digital nurse Faithful. She posted how she was working as a set nurse and how she was able to meet up with a lot of people, connect with a lot of people. I'm like, this is something I could explore. And so immediately that came to my mind. I reached out to Miss Brunhilda about wanting to be in the behind the scenes of her set as a set nurse, and she told me like, okay, when an opportunity comes up, she's going to hit me up. And immediately the production for hand job came up. She reached out and she was like, okay, we'll be shooting in the early weeks of April. I don't know, if you're in, just let me know. And I was in fully. So you can connect with people, you can apply. Like in Cameroon, there are so many production houses. Like I mentioned in before, there is Stephanie Tom MB production, Can Quintus Lions production, something like that. And then there's Benlinian production. Those are the four people I know that are constantly producing movies. There is Amy Dani Basong, she Ed Bass Production, she produces movies. You can reach out to them. There is also Ebenezer Kepombia. He also produces movies. So you can reach out to them and be like, okay, you're offering your services as a set nurse, and you explain what exactly you're going to be doing. But beginning it's not going to make sense to them because they are not aware of the importance of a set nurse. But with time, girl, they're going to hit you up and they'll be like, yeah, they need it. Another question I got was like, do I have like some foundational knowledge on movie production or anything? I have no clue. All I know about movies is to watch them. Yeah, and I'm a binge watcher. So that's all I practically know about movies watching. I have no knowledge. I've not gone to any film school. I've never been in the behind the scenes of a movie. This is my first one, and you absolutely do not need it. All you need is your nursing. But if you want to know it, it's a plus for you, and if you know it, it's a plus on your side because you just be understanding how everything moves, and then you exactly know how you can behave yourself there, what you need on set and everything. Yeah, but it's not a must. It's not a must. So another question I got is, what exactly do I manage? What are the things I take care of? So generally I manage emergencies on set. A cut, a sprain, headache, fainting, some people with asthma attacks, and maybe eye issues. Anything that's an emergency that needs first aid. That's what I manage as a set nurse. Simple. That's all I do. And if it gets complex, if it's difficult, we refer to a hospital. The hospitals, I have emergency contacts of hospitals that we can reach out to at any time that we know that they are available to welcome emergencies. So, and we have a car available, like in case there's an emergency, the person can easily be transported to a nearby hospital. For this question, nobody asked me, but I'm going to be giving you an answer to it. So I know you're going to be wondering, like, okay, what do you pack in your emergency kit? Is generally what you pack in every emergency kit. Everything, like blood pressure machine, a thermometer, and hand sanitizers, wound care equipment, that's bandage, plaster, saline, povidone iodine, hydrogen peroxide, splint, like gloves, medication, pain meds, medications for fever, everything that you need, right? And some eye drops. You can get allergic medications for anybody that may be reacting to any allergy, be it the sun, be it to food or any drinks. Just get yourself ready. Get yourself ready. Be very equipped. If you can carry a lot, carry them. So the next question I get often is it stressful than bedside nursing? What I would say is nah. It is not stressful. Bedside nursing is the most stressful nursing job I've ever seen in my life because it's flexible. Like I said in the minute before this, I was like, there are times where they're filming. Like right now, I'm making my videos at the place we are lodged because they've gone out to shoot somewhere they might not really need a lot of crowd because the actors need to be so focused. Except when emergency comes up, they'll call me and I'll go there. Right. So right now I'm doing my videos, I'm flexing, and after this I can just sleep. Right. So it's flexible, really flexible. Like you can add weight while doing this job. Why bedside nursing? What would I say to be doing videos? By now, I'd have been doing a lot of things, and they'll be like, nurse, 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 this, nurse, that, nurse, that. But right now, it's really stress free. Another question I got is how long have I, or how long do I stay working? So, generally, if you're going to be working as a set nurse in a movie production, you would have to be lodged around the movie production site. So if you're living very far, you have to relocate and you're going to be around there. Like for me, I was juggling between two jobs. There are times where I'll be lodged where everyone was lodged, every cast and crew member was lodged, and there are times where I'll go back to my house because I have to go for my bedside nursing job. So you're going to be working there all the time. If you're someone who freelances all the time and you don't have a permanent job somewhere that you need to be signing in, you can just relocate and just come and be there. Though it's plenty trouble because you are going to be meeting with a lot of people, different characters, behaving differently, and then it's going to be stressful. But if you're someone who loves your privacy, you might stay where you are, but it's going to be difficult. But for example, if it's that you have to travel out of the country, out of town, you still have to lodge with. And when I'm reading this question I'm about to talk about, I laugh. Someone's like, how much can you earn? It will depend on you. If you know your worth, you can put a price tag to it. The people earn 50k per movie production, 100k, 200k, 250k, 200k, depending on the production. If it's a big and massive production, you can ask you some money. I cannot tell you what you price. You can put a price tag to your brand as a nurse. Be like, yeah. I cannot tell you. You're like, yeah, just put, if you know your worth, you know what you put to your head. You can talk to your body like, you guys are gonna pay me this. And don't be stupid, don't be foolish to just go like that. You have to discuss your monetary terms, like this is this and not that. And make sure you have a contract. Make sure you have a work contract that binds both of you, because people's brain, they do shake. Yeah. So how can nurses in Cameroon like myself, you're a new nurse, you're a pro, you're a veteran, you've been practicing for many years, you just started practicing whatever category you are, how can you get into the movie industry? All I would say is network. We say network every day. Your network is your net worth, right? The people you know will help you become who you want to become. So network. Yeah, movie premieres, go to movie, get a ticket, buy a ticket, go to a movie premiere, connect with them, take pictures with them, get their numbers, and be like, I'm a nurse and I can help with your nursing services during your next production. And I think the next time they're having something, you apply. Because people do not know about it. Some people, no one knows about it. These people are shocked when I say I'm a set nurse. They're like, you're acting. I'm like, no, I'm not acting. So you have to connect. You have to make friends. You have to follow them. You have to like their posts. If it's on YouTube, go on YouTube, watch, screen record, and post and tag them that I just watched your movie. So next time if you're reaching them on their inbox, and you're like, Ma, I've watched your movies and I'm a set nurse. I think you need to serve some set nurse. And blah, blah, they're going to grant you that opportunity. So that's basically it. It's not that complex. So I've come to the end of this question session on my YouTube, and one advice I have for nurses out there who want to get into the movie industry as said nurses is stay professional, stay teachable, be ready to learn, be open to learn every day, because you have to learn a lot of things, not just about nursing, about movie production. Stay curious, connect with people, network, build your brand on social media. Yeah. Most nurses do not want to be on the social media space, especially Cameroonian nurses. Everybody's just hiding in their shells, and then we sit there and complain about a lot of things. Go out there, tell your nursing story. Yeah. Tell your nursing story boldly. There are so many controversies about nurses, so many things people say, but we can be the only people to say what is true. Those who are speaking, they are not nurses. They are not necessarily just sharing their experiences, but now we can come out there and share our own experiences, tell them the truth, the reality of the nursing profession. And with that, I believe you can be able to land yourself a massive movie production job as a set nurse. You can. There are many movie production houses in Cameroon and the world. You can land yourself one, which will take you to countries. You can travel to countries, to America, to London. You can go to Nigeria, like MB production. She places in Nigeria most of the time. So you can be as and she flies you to Nigeria. Is that not beautiful? So thank you for watching this video. I know this video is somehow long, but I know it was also very educative for everyone or anyone who is interested in said nursing. Bye bye. Don't forget to subscribe, like, and comment.